to get my catheter ready to go. These catheters are a little bit different than the ones that we use. But the ones that we, yeah, these are training purposes. The ones that we use have a little, like a groove thing that you can kind of get your finger stuck on there, and you, it pushes forward like that. So I always like to keep my finger on that, because when you're going in, if you have to come back out, that catheter can slide back and forth, and that potentially could blow your vein. So you want to make sure that you've got your finger on that side when you're getting ready to do it. Okay? And with the catheters we use, once you get your flash, you have to go just a little bit further and then start to thread. When you thread, you shouldn't be getting any kind of resistance. It should be fairly smooth, just like if y'all, just like you do like that. You shouldn't be having to press. Otherwise, you're probably going to be going through the vein. Okay, so I'm ready to stick. And I've heard some people say, okay, little pinch. And I would be mad if somebody told me that. I want them to tell me the truth, because this is going to hurt. So I just tell them big stick, you know, and then they know, because I mean, already you kind of have, your credibilities went down once you've tell them that, because they're like, man, they lied to me. So, okay, so we got the bevel up, and we're going to stick here. And we just say, okay, 1, 2, 3, or just tell them anything like that, and say, here we go, and then we go in, and I've noticed a flash here, will pop, and I'm going to go just a little bit further than that, and then I'm going to start to thread my catheter, okay? And see, the needle is not all the way in here, because you're potentially going to blow your vein if you do. Okay, so if I had to draw some blood, I would have an empty syringe here, and I would connect this up here, and then I can just draw back. I've got my blood right there all ready to go. But I'm not going to draw any blood today. So I've got my blood here, or, you know, right here. And, I mean, there's nothing, it's not going to keep coming back, gushing right there. So I don't have to panic. So, and I see a lot of people, they get real nervous once they do, and they're like, oh my God, and then they make a mess, and then it'll, okay, just once you see your thing there, pull your tourniquet here, pop it.
You pop it after the flash?
Pop it there. If I needed to draw blood, I would keep it on there, because you want the blood to keep gushing. Okay, so then I tell them lots of pressure, and don't be afraid to really press down there, okay? Because that's going to be where your mess comes in if you don't do that. You can take this right here and put it up underneath here if you want to. That kind of helps your mess. Okay, so I've got that, and this, how does this one pop?
That's what I want to know, because that's the important part.
This one,
It doesn't have a button on it.
Well, you might just have to pull it out.
Yeah, maybe this is just it looks like it doesn't look like a safety one.
Yeah.
Okay, so at that point, I would be pressing my button
Right.
to, because I do not want a live needle coming out of there, okay? So, do you know if are these safety? Or are these not safety?
No, they're not, because we're going to reuse them for the OSCE, that's why
They're
they...
gonna reuse them.
Okay, they're going to use them.
They're gonna use, everybody's gonna have their own.
Okay.
But we press it as we're taking it out.
Press it as you're taking it out. And because I don't want this, I see some people set them down and then there's a real needle there, but when you're taking it out, go ahead and press it then. But all your needles in the hospitals now are required to be safety. So we have one at Centennial that when you pull it out, you don't have to push a button, it's just a blunt tip on the end. So they're all kind of different. You know, you'll have to kind of get used to what the catheter is, you know. Okay, so I've pressed that. That's going to stop my blood flow, and I'm going to have to really push it. And then I'm going to connect here. Make sure you screw it on nice and tight. And then if blood has come back a little bit, I can take this alcohol and kind of suck it up around there. And that way, when you put your dressing on, it's not going to be all nasty. Okay, and then I'm going to give a little flush here. Is this okay if I flush it in this guy? I don't know. Okay. Okay.
I don't know where it's gonna go, but.
Okay, well, it's in there somewhere. Okay. I may be leaking somewhere. Okay, so I flushed it. It didn't puff up or anything, so it's good. So what I'm going to do is go ahead and dress it.
Now, what we are gonna, for the exam, the actual exam, you're not gonna have what she's about to put on there.
Okay.
You're gonna use tape.
So I want to see the
So
tape.
everybody will use tape.
Okay, so what you can do on that
We don't have those.
is some people
Not gonna lie to you.
people do these differently, and you can do a chevron, which is like this, back
So
like
go
a
back
kind of like a
go
butterfly
under
type
and
thing,
above,
yeah.
yeah.
And I've kind of shorted this side a little bit. Yeah, just so it stays on there. Some people may take this right here and do differently, like if I can get it back off, like put it like this and like that, and then put another piece.
Okay.
A piece over top of
As long as you
this.
tape it on.
Yeah, as long as you're taping it on. Like I said, I usually just block my opposite, and you're gonna have to have one of these when y'all get out there in the real world.
Yeah.
Yeah. So I'm gonna pretend like y'all have this. Just say I'm doing my opposite right there.
But we're not gonna grade you.
Okay.
Well, just
Not for the exam.
yeah. Pretend like you did, because potentially you do want to know when this was put in, because the nurse is gonna have to change it in 3 days. If it doesn't go bad before then.
You just don't get graded.
Right. So I've got all this here, and then that's when I put the rest of my tape on. And
Are we having this, or are we gonna have an actual saline bag? So it'll just be this? Okay. I just want to be sure.
and you don't have to flush a bunch in there, just a cc or two, just to make sure that because it's gonna puff up if it's not in there.
Just make sure it's painted. Okay.
And I put another piece of tape here. And then I usually like to put one up here too, so that if somebody comes by, they're not going to be able to just pull it out real easily. And then I'm going to connect my fluid right there, and they're ready to go. We use the drip, so we don't use the pumps a lot of times here. So just make your drip factor a little bit lower. Don't want to have it keep going and bolusing the patient constantly if you don't have to do that.
Thank you so